Hello, I'm Dr. Peter Bergen. I'm a neurologist working at Auckland Hospital, and I have a particular interest in the management of epilepsy. In this video we're going to show you how to administer midazolam. Now this can be used as an emergency treatment to terminate seizures or to prevent clusters of seizures. Midazolam is a drug which is originally developed as a sedative, and when it's given intravenously it will put people to sleep. But recent studies have shown that it can be used by placing into a person's mouth, and it will often terminate a seizure. And similarly, if people are having multiple seizures, by giving it in this way, it's often possible to prevent further seizures. The actual details as to when it should be given will vary from individual to individual, and you'll need to discuss the exact administration with your own doctor. But in this video we'll show how the midazolam should be given.
Midazolam for buccal administration comes in two types of packaging, plastic and glass. Glass ampules are gradually being phased out as the plastic ampules are easier for caregivers to use. Each ampule contains the medication name, the dose, the expiry date, and often it's labelled for slow IV or intramuscular injection. These are also suitable for buccal use. A prerequisite for administration of midazolam is a current first aid certificate, including good knowledge of CPR. The knowledge of a person's epilepsy, their epilepsy plan, and their midazolam protocol, which is written in conjunction with the doctors or specialists. Staff must be trained for safe midazolam administration, and proof of competency is held on their staff file. Giving buccal midazolam, you must note the time of the onset of the seizure. Check the medication pharmacy chart and the midazolam plan. Check the expiry date on the ampule. Check the ampule dosage as 15 milligrams per 3 mils. Twist the top of the ampule. Reposition the person's head. Then invert the ampule. Administer the midazolam between the lower side of the person's cheek and teeth. Drip slowly. Approximately 1 drip per second. Do not squirt into the mouth, as this needs to be absorbed, not swallowed. As soon as practicable, turn the person onto their side in the recovery position, or support their head if they're sitting in a wheelchair. Maintain the clear airway. Note the time of the seizure stopping. Stay with that person. Follow standard first aid practice until recovered. At any time of the seizure or procedure, call 111 for ambulance if you are not sure. Document in their seizure recording sheets, their signing sheets, and inform your manager or on-call manager.
So Linnea has now given the midazolam and the seizure has stopped. There's 15 milligrams in the 3 ml ampule, and for an adult we would suggest that you give the full amount. It won't work immediately. It takes several minutes before the midazolam is actually absorbed into the blood through the lining of the mouth or the buccal mucosa. So you do need to be patient and be aware that the seizure will continue probably for several minutes after the midazolam has been given. Don't worry if not all the midazolam gets absorbed, if some of it does drip out again. Any that's absorbed is beneficial, and so if a third of it or even a half of it spills out of the person's mouth, don't worry. If the seizure continues for 10 minutes after you've given the midazolam, then it would often be possible to give a second dose, but that will need to be discussed with the doctor in advance. Midazolam is usually well tolerated. It often causes a person to become sleepy. If it's given to someone who's wide awake, they will often feel a bit dizzy or lightheaded and sometimes get a bit giggly. But we wouldn't expect any of these side effects in this circumstance where it's been given to the person who has had a seizure. It's important that somebody stays with the person until they've started to recover. But we would not expect any complications to arise from the use of midazolam in this situation.